Congressman Dr. Brad Wenstrup, welcome to the Bill Cunningham Show. And Brad, Merry Christmas.
Thank you. Same to you, Bill. It's always a pleasure.
Talk about this afternoon. What's happening? Because I talked to you, I texted last night, this morning. You said, well, we got to see what's going on. But I understand all hell's breaking loose because of Ukraine, because of Nancy Pelosi's predilections, because of the National Defense Authorization Act, because of upping the limit of borrowing, the fact that the Senate's going to consider sometime before Christmas, according to Chuck Schumer, that they're going to pass the Build Back Better Communist Act, and they're going to send it, and there'll be some changes, then they'll have to go back to the House, and God knows what's going on. So on a Wednesday afternoon, what do you do in Congress when you have a real life to lead? You got wife and children, and you have a little bit of a medical practice still going on, and then you also have to deal with Nancy Pelosi. What's top of mind with you?
Well, just trying to wonder what's coming next, because our schedule has been changing all the time. And even Democrats will say, you know, the place runs much better when you guys are in charge. And, you know, she's still playing games where we have to go through a magnetometer to get onto the floor of the House. And we're still wearing masks on the floor of the House. And it's just, but the schedule is just constantly changing. There've been a lot of unorganized weeks and days where, you know, we're voting until 10 o'clock tonight, and maybe we'll be here tomorrow, maybe we won't. So our schedulers are having the hardest times, I'd say. But, you know, we want to get home every weekend, and we want to have some idea of when that is. But this is part of what we signed up for, but it's been a little bit out of control this past year, especially.
Talk about three issues. Talk about H.R. 550, which is Immunization Infrastructure and Modernization Act. And this is the effort of the federal government to get more of your personal medical data and to have the haves and the have-nots, the good guys and the bad guys. Explain what that is and why you and Congressman Banks of Indiana want to have a significant change of what the administration wants to do.
Well, I think there's a lot of misperceptions about this bill, and I think, you know, maybe we need to do a little better job sometimes within our own conference of explaining what we're for and why. In March, the Democrats included millions of dollars to improve the immunization information system. So this is, and they put that in their partisan spending bill. But there was no descriptive language or guardrails on how that money was to be spent, and that was our concern. So Dr. Larry Bashan, who's a conservative Republican from Indiana, a cardiothoracic surgeon, part of our doctors caucus, he was involved with this, concerned how the federal government would interpret the language and abuse Americans' medical privacies, which we see that under Democrat control, they like to do that as often as they possibly can, it seems. So that's why Bouchon helped write and introduce the bill to tell the Biden government to keep their hands off of Americans' private medical information. So the Centers for Disease Control does not and will not have your vaccination records. And I want to be perfectly clear. These are state-run systems that have existed for decades, and this bill is aimed to beef up security of them and establish guardrails to prevent any kind of abuse by the administration. So again, millions of dollars have already gone out to so-called improve IIS, and that's all it really says. But there was no descriptive language or guardrails on what that meant. So this bill lays out in detail what is meant by improving it while protecting the state's rights and personal information for people, and ensure that money that was already appropriated is not going to anything outside of actually modernizing the system, and it doesn't go anything towards vaccine mandates. So there was a lot of misinterpretation and understanding that this system was in place to really have some idea of vaccinations, and we're talking about childhood vaccinations and everything else. So this was never set up for COVID to begin with, and so what this bill did is put guardrails in. And you know, the Democrats were going to spend the money anyway. We wanted to make sure that it was done in a way that protects people's privacy. And you know, that was important, and the information is de-identified, if you will.
Well, I look at what's happening in Europe and relative to what Biden's doing with American citizens coming back from Europe have got to have all the vaccinations, all their COVID immunizations up to date. Plus, you have to have a negative test within 24 hours, which is very difficult sometimes. But that doesn't apply to the southern border, in which hundreds of thousands every month flood across with no testing, no vaccination, shipped all over the country. They can't be serious. But the next step is that if you travel on interstate commerce, whether on a plane, a truck driver, a train, a Greyhound bus, you have to have your immunization to get on a bus. Is that something we need to be concerned about going forward into next year, about having our COVID shots to take a trip?
I hope we don't have to. Look, I am pro-vaccine.
Me too.
I know you've been vaccinated. I've been vaccinated. But I think that's a conversation people have with their doctor. And if you look at the mandate, where's the doctor in all this? Where does the patient turn to talk to about the risks and the benefits and, what you should be concerned about and what you don't have to be concerned about? There's no doubt this vaccine has saved hundreds of thousands of lives. I have no doubt about that. But in a free country, and as a medical practitioner, as a physician, I understand the value of having conversations with your patients. This completely eliminates that. And, Americans, they don't want to be indoctrinated. They don't want to live in a country that is tyrannical and tells you what you must do, or with the threat of losing your job. And so some people that have even been vaccinated are extremely against these mandates because they don't feel it's the right way to go. And I don't either. I think it's a conversation with you and your doctor. And besides that, COVID's not going away. So if you had vaccinated 110% of the world, we're still going to have COVID because these viruses produce variants. And we know even with the vaccine trials that even vaccinated people got it. They didn't get it sick, and there weren't as many people getting it. Definitely has had a positive effect. But we need to focus on therapeutics if we want to save lives going forward and not shut down our country and every component of it. I'm concerned about how many people will be left in the military. I'm concerned, as someone who sits on the intelligence committee, how many people are going to be left doing the work of the intelligence community on behalf of our country. So these are things that aren't being taken into consideration. And truthfully, the hypocrisy of people coming across the border, they're not tested, they're not vaccinated. I mean, it is really unbelievable, and they just bury their head in the sand on that, like, don't look this way. So it doesn't make any sense. And if this was so serious of a problem that we need to get everyone vaccinated right now, which I would prefer it. But if it's so serious a problem, why are you delaying it? Why did they go from December to January on this? So it seems more political than anything else. But if we had the administration focusing on Operation Warp Speed to develop more therapeutics like we have with monoclonal antibodies, we'd all be better served.
Because it's going to be here at least through the end of this century. What's another 79 years? It's going to be here. And I think the Pfizer and the Merck had seemingly good drugs that may wash out the system. I've had friends who take a Z-Pack and they get the hydroxychloroquine or they do some other, of course, the monoclonals, I guess, are the best. And so this isn't a death sentence like Ebola is a death sentence. You get Ebola, you just get your affairs in order and die. If you catch COVID-19, the great majority of people, 99.8%, do quite well. And so maybe on one hand, it's a control mechanism of government to force us to do things. But on the other hand, if this was Ebola, if this was something that killed 60, 70% it came in contact with instead of 0.2%, then you understand why on the southern border they're following the mechanisms that they want to follow, because those are hundreds of thousands or millions of new voters coming across the southern border, many without their original shots for measles and whooping cough and pertussis and all the rest. They're generally not as healthy individuals as an American, so they're ignoring a couple million people that came across the southern border without any shots of any type and quickly dispersed them all over the country. And if it was serious, they wouldn't have done that. And they do that on one hand, and then on the other hand, they force American citizens and those with green cards coming back into the country to jump through hoops. And if you're traveling from maybe India or Asia or Eastern Europe to come into America, it may take 24 hours to travel. So by the time you finally reach the entry point back into the U.S. where you're a citizen, if it's outside of 24 hours of your test, you're in stasis and got to be held in solitary confinement till you get another test and another test. But if you're on the southern border, just come on in, put you on Greyhound buses or planes, and ship you all over the country. And the media quit covering it. Why do they quit covering it, Brad? Why would CNN quit covering the midnight flights all over the country?
Because it doesn't fit their narrative, and it's a political narrative. I know the medical director, basically for Department of Homeland Security. He's somebody I know, worked with, and trust. And, he'll tell you that it's not just COVID coming across the border. There's other things, and we're trying to get people to treatment all the time as best as we can if we happen to catch some of those other things. But as far as COVID, you're only tested if you have symptoms. And, a lot of people are asymptomatic. And that's part of the spread. So wouldn't you want to at least vaccinate them?
Yeah.
So, you used to say you can't have it both ways. But when you have control of the House and the Senate and the White House and the media, you can have it both ways.
Now, lastly, you're a soldier. You kind of draw water from many wells. You're a soldier. You're a physician, and you're a congressman. And right now, the drumbeat is beginning for American soldiers to, I guess, fight and die in Ukraine. And I'm looking at this and I'm going, the Russian leadership exploits every opportunity to weaken the U.S. and its allies whenever it can. And I don't want my son, my grandson, my granddaughter, who now I guess has to sign up for the draft, I do not want them looking at the Ukraine as something. We've had the military adventures, and if we go to war somehow with Russia and Ukraine, we're going to get the crap kicked out of us again, as we did in Afghanistan, Iraq, and Vietnam. And so as a military guy, maybe you have more presidents and others in the Congress. What are your thoughts about American involvement in Ukraine, which most of us can't find on a map?
Well, I think that we certainly want to keep Ukraine a democracy and have it grow, and we certainly don't want it becoming just another tenant of the Russian influence and sphere, or maybe even part of Russia like they have done in Crimea. So we want to empower Ukraine, but we have several tools, and I am glad to hear at least talk from this administration about increasing sanctions that can be very crippling to the Russian government. But at the same time, you empowered Russia. You empowered Russia when you allowed their pipeline to go through so they can make money off of our allies and then feed their military and advance their military and shut down ours. You can't, these things don't make sense. So we certainly do want to enable Ukraine as much as possible. But there's other tools that we can use. Sure. They can really bring Russia to their knees, and we can't be afraid to do it. And we use diplomacy, we use our military, we use economic type of things and measures, and that's what we need to be doing, are some of these others, and avoid that. But Russia, I think, feels right now is the opportunity. You see us getting out of Afghanistan the way that we did, where we didn't even pay respect to the people that worked with us, and in fact, we didn't pay respect to Americans that were there. And also, we left all our equipment. And so, it doesn't look good on the world stage when we do that. So I hope some backbone starts to develop, that we stand up, and we're concerned about China and Taiwan as well. I mean, these are very important things taking place in the world that need to be addressed. They need to be addressed for the security of the world and for America. But let's try and do it without having to send our troops.
Well, Merry Christmas, Happy New Year. Are you happy with what you're doing?
Yeah, I feel like I'm in a place where I'm needed. There are a lot of things that we get done that you never hear about. They don't meet the mainstream media narrative sometimes. But I'm here in a way that I think our founders had in mind, which is you go out and do something in life first, and then you bring those experience and skills to the table. Right. We've got too many people here that make business decisions that never ran a business, and are making healthcare decisions that never saw a patient, have no clue that what they're doing is making it tougher on patients and physicians. And then we've got people making military decisions that never served. I think we need more people that come from walks of life that can really weigh in on the issues that affect Americans each and every day. And I have the chance to do that. I would rather be in the majority, and that's what I'm working for now. Lastly,
as a UC man, does Alabama Roll Tide have a chance against the UC Bearcats?
You know, I think Georgia laid down just because they didn't want to play UC. Don't you, Bill?
Well, look what happened last year. Except for some clock management, UC would have beaten Georgia last year. They dominated them. They dominated Notre Dame and South Bend. That drives Rocky Boyman nuts. And I think it's true that Alabama won three SEC games, 3 games, by a total of 8 points. And so this is not the Alabama team of yore, and the UC Bearcat team is the greatest of all time. In fact, I think the Bearcats are playing better than the Bengals.
They're playing really well. It's been a fun season. I've been a season ticket holder for many, many years, and used to sit in an empty stadium. And now it was really fun to see what happened last week and to watch that field get covered with fans at the end of the day. Look, we're the underdog for the first time. You know, we've had win out every game. You know, after about 6 games, the word was, well, if UC wants to get in, they have to win every game the rest of the season. Well, they did it. And now giddy up. Let's go in as the underdog and show them what we got.
I say unroll the tide. Congressman Dr. Brad Wenstrup, Colonel, thank you again for coming on the Bill Cunningham Show, likely the last time this year. But I wish you and yours a Merry Christmas and a Happy New Year.
Thank you. Same to you, Bill. God bless.
Brad Wenstrup. Thank you, Brad. Let's